Good evening, everyone, and welcome to yet another of the IHW talk series with doctors, specialists, and answers to the questions that you might have about various health issues. This evening, our focus is on understanding infertility and how couples can move forward on such a difficult and life-altering topic. Becoming parent is one of the happiest things that couples can embark on. But for many, that journey is thwarted right at the beginning. How do they cope with the hurdles that are placed in their way? What is it that they can do? For that, we have the privilege of having Dr. Shweta Mittal Gupta joining this evening with us for this conversation that is very kindly supported by Bharat Serums and Vaccines through their public health initiative. Dr. Mittal Gupta is an infertility and IVF specialist working as a senior consultant in the Assisted Reproductive Center and at the Sir Ganga Ram Hospital. She has handled thousands of such pregnancy cases, and she is here to share with us of her expertise. Dr. Shweta Mittal Gupta, thank you so much for joining with us this evening. I see that you are still in your clinic, and thank you for taking the time out to speak to us and to help our audience members understand where and how they should move forward once they're confronted with the issues of infertility. But before we begin, let's ask you the question. Of 100 married couples, newly married couples, in today's time, in your practice, just how many come up with the difficulty of conceiving? Ma'am, you're on mute. We'll have to put your...
Am I audible?
Thank you.
Yeah. So
yes,
yeah, I would
ahead.
say that still the incidence of infertility is to the tune of about 10 to 15% per 100 couples. But if you see in my practice, because I'm a referral center and I'm going to be looking at patients who are not conceiving, so naturally the fertile population is not coming to us. So just telling that, what is the exact incidence is, of course, something which we will totally depend upon, what the surveys would be saying.
Yeah, and so the reason why I asked you the question was it's a broad question. Also, the question comes in: is there a difference in the incidence rate of the percentage of couples who are coming with infertility difficulties? Does that differ between urban and rural areas?
So, I would say that by and large, the indications, what is the scenario in urban cities, I could say, is very evidently, especially the IT sectors, or if you look at, doctors, if you look at, people who are highly into professional jobs, yes, there's a delay in the childbirth. That's there because girls are as competitive as men now in this world. So maybe in urban cities, we would see that, yes, there is a delay in the childbearing and there could be certain issues associated with their social habits and delayed childbearing, which may not be still there in rural areas. But in rural areas, we could see more of pelvic infections, more of, maybe tuberculosis kind of things, which could be more prevalent. And you would be still having them. You still have them in the urban population, but it could be to the lesser extent. But they will have other situations like endometriosis, or there could be more male factor. But by and large, I would say, if you look at a unanimous distribution, then it would be more or less the same.
Ji, thank you so much. And the reason why I asked you that question is to help our audience understand that if there are 100 couples, अगर 100 शादीशुदा नए शादीशुदा couples हैं, तो उनमें से 10 से 15 के बीच उनमें फर्टिलिटी की इश्यूज आ सकती हैं. ये रूरल एरियाज में या अर्बन एरियाज में ज्यादा फर्क नहीं पड़ता है एट एन एवरेज लेवल, बट जैसे डॉक्टर साहब ने कहा, we will see more of the issues in the urban areas, perhaps because there is a tendency towards a later age at marriage, or a delaying in pregnancy, or because of lifestyle issues. And I wanted to clarify that right in the beginning so that we can kind of get some basic concepts out of the way. You mentioned, Dr. Something about infections. Let's get that out of the way, because infections means you can probably treat them. What are the
Yeah.
kinds of infections, and what are the things that people should be aware of? Does it happen before marriage? Does it happen just after they are married and when a couple is beginning to live together? Or is there something that can be done that reduces the risks of infections and prevents fertility issues from cropping up?
So, in when we're looking at fertility, we are looking at pelvic infections, and we are basically looking at sexually transmitted infections. So, have that basic knowledge that how these infections will not pass on from partners to partners, and maybe it is basically seen more in multiple partners. If a person has multiple partners, then it will be more commonly seen. And then it has also got to do with the way you are living, the hygiene, what you are maintaining, and the lower socioeconomic strata maybe would be seeing more of tuberculosis. So pelvic infections due to tuberculosis could be more in undernourished and more of underprivileged society, as compared to more of sexually transmitted infections, which could be in this society, but it could be in both equally. So I
Thank
think
you,
it
Doctor.
is awareness, which is, I think, awareness and prevention, which is very important.
Thank you so much. And so, therefore, audience, I mean, this is something that is of importance for us to understand, that there are issues of hygiene, there are issues of personal behavior, there are issues of being aware of infections or probability of infections that we should be careful about. If there is the chance of a burning, if you feel that when you're passing urine, there's men or women, if there is a burning in the urine, or if for women you see a little bit of a foul smelling discharge, or if men you do definitely see a discharge, then please avoid sexual activity. Please consult with a doctor. These are easily treatable conditions, and your gynecologist or your family physician should be helping you to guide you to an appropriate solution so that you don't end up in a difficulty. Because unmanaged, you will have to take the help of Dr. Shweta Mittal Gupta. How's that, ma'am, for a summary of the things that can be
Yes.
avoided?
So I think early intervention, so it's prevention, awareness, prevention. And in case you happen to have it, then early intervention is something which will, benefit you and will prevent you from a long-term complication, especially when we are looking at fertility issues.
Thank you so much, ma'am. So, for the audience, infective causes are relatively easy to prevent. And if in case you do have a infection or so, do not treat them as Gupta Rog. Yes, they to the private parts of your body, but please do consult doctors. Do not waste time, because if you do address them in time, you will save yourself the misery. You will also be able to then look forward to a start of a pregnancy as and when you desire it. Ma'am, one more thing.
Yes.
After solving the issue around infections, when should couples be worried if a pregnancy is not happening?
So, there is a cutoff. What we will say that if a couple who's cohabiting regularly has been trying for about 1 year, then it's time to visit us. However, there are certain, certain notions to it, or things what you need to know, that if the female partner is having menstrual issues, delayed cycles, not having them properly, having them too quickly, or if the female partner's age is 35 and above, then this cutoff is much earlier. It could be 6 months. And if you have some menstrual problems, then it is way earlier. You should consult. Then don't wait for 1 year mark. So it's not a dictum, but by and large, it is about 1 year.
Thank you. To translate this, or to kind of repackage what ma'am has said, if you're married and you're in your 20s and you've been trying to have a baby for about a year and you're not seeing a pregnancy start off, time to begin thinking about consulting a doctor. However, if especially the lady is over 35 Or if there are difficulties with your menstrual cycles or irregularities, as ma'am has said, then you should be consulting a doctor much earlier. And if you do so, chances are Dr. Mittal Gupta might be able to help you better than if you turn up later. So, in all matters of health, getting to the doctor earlier is always a better idea than getting later. You save yourself trouble, you save them from having to work too much on you. Ma'am,
Yes.
now that we have a couple who's tried for a year, they haven't used a contraceptive. So remember this, if you've used a contraceptive for a year and you're thinking that there will be a pregnancy, no, that may not happen. If you've used an oral contraceptive in between, that may also probably delay you a little bit. If you've used injectable contraceptives, that may also have a little bit of a variation that your doctor will help you understand. But besides all of that, once a couple turns up with somebody like Dr. Shweta Mittal Gupta in the fertility center in Sir Ganga Ram Hospital, what would your first set of advice be, and what's your plan of action now?
So, when a couple walks in, now we see many patients every day. So, most important is that the couple should walk in together. So, come as a couple. It's very important because,
Let
history
me
from
repeat that.
the
Let
female
me repeat
partner.
that. Let
Yeah.
me repeat that for you. This is a joint venture. You are not going to go to the doctor one by one. You're going to come in as a couple. And I wanted to underline that. That's why I interrupted Dr. Shweta. I mean, you have to come together. Yes, ma'am. Please go
It's
ahead.
very important because, I know that female will carry the child, but the issue could be equally in the male partner too. So a detailed history is something which is very important in a case of, couple who are trying to conceive. Now we may have a couple who's completely treatment naive, that means never taken any treatment, walking in for the first time and don't have any reports with them. And then there could be couples who have gone from pillar to post or have gone to different centers and taken different kinds of treatment. So it's very important to bring all your old documents. And then there is a way to elicit the history where we are going to ask many multiple questions. So primarily this would be involving, that since how long they've been trying, are they aware of the fertile, days? Did they use any contraception? Did they have any pregnancy in the past? Very important history is any tubal pregnancy in the past. Then of course, history which is suggestive of any pelvic infections, their personal habits, their family history would be elicited. And then they would involve a clinical examination, and the male partners also ask similar kind of history, especially their medical history. So things like diabetes, hypertension, any antidepressants they are taking, any surgery which has been done in the past. It's very important to know if any childhood cancers have been treated in both the partners. So, history of recurrent infections, so anything which is worth mentioning. I would say very important history in men are hernia, hydrocele, things like childhood undescended testis, where the mother will say that yes, my child was operated, and then any surgeries which a girl must have gone through before actually getting married and finding a partner is very important. And then comes the battery of tests, where very important is
Let's,
semen.
before we come to the test, ma'am,
Yeah.
before we come to the test, just to kind of, because ma'am has said so many things, let me just unpack very quickly. One, infertility could be because of the male, could be because of the female, and could be both too. Okay.
Yes,
And so
absolutely.
one thing that we would like to underscore here is this: infertility is not the start of a blame game. And this should be something that all couples should realize and the whole family should realize. A baby does not happen just with a woman. A baby happens with a man and a woman together. And sometimes the problem is with the man. And there is no shame in this. So when you come to the doctor will equally talk to the wife and also to the male partner. And both of you will require being frank and honest with every single detail that the doctor will ask, because sometimes it may be the smallest detail that might give a clue to Dr. Shweta that this is something that needs to be sorted out, or this is the reason why there may be an infertility issue. So, confidence in your doctor, no blame game, and complete frankness is something that is required, because a good history will enable Dr. Saab to then suggest the next set of tests. Yes, ma'am. what are the tests that you would want?
So, just before that, one more word that couples are very shy telling about, their cohabiting history. And as so many times when we delve into the history, we come to know that they have never cohabited at all. And it's very important, because what happens is normally you will see father, mother coming along with the couple. So we always like to take history, in privacy. And that is something so important. And it has to be, told to us very frankly. Yes, coming to investigations, I would say that there are...
One more, ma'am. Since you've said that that's important, I might as well kind of underscore that. Couples, please come together. Try to come in without your parents, because that's a slightly more difficult conversation. If the doctor wants to talk to your parents, sure, she'll ask for them. But here is a matter of confidence. The doctor needs to know everything from you, including very intimate details. Because at the end of the day, if they don't know, they can't help you. So please don't hide, and please don't be shy. Your doctor is your best friend in this situation and is bound to confidentiality. They're not going to tell your things to anybody else. That's what being a doctor means. So please, in the confidence that the doctor is your best friend, talk to her or talk to him. Yes, ma'am.
So if we are looking at tests for the male partner, it's a more simpler process, because the first test is a semen analysis, which is performed well in a standard lab with all the instructions which have been followed. For the female partner, we want to look at three very important things. One is, besides the normal test, besides her blood count, besides her thyroid, besides her blood sugar and things like that. But we want to know that what is her ovarian reserve. So there is an ultrasound and there is a set of blood tests which can help us. Number two, I would like to know whether the tubes are patent or not, because we might be giving her treatment and then in the end we come to know that there are tubal defects. And the third is that, is she ovulating every month? So which can also be done with the help of either, simple urine test, or with the help of ultrasound, or with the help of hormonal test. So I would say these basic four things when a couple comes to my OPD is what I want to check.
It is easier for Dr. Shweta to first check for the male partner. It's so much more simpler, less invasive, and sometimes faster to get to knowing what's going on. So men, please do not be worried or ashamed or get agitated if the doctor asks you for getting a simple semen test or a semen analysis done. That might be the fastest and the simplest way of going about it. Once she's done with the male side, simultaneously or after the other, she would then be looking at your wife much more closely. And simply because of the way the anatomy is, she will have to then get things by ultrasound or by poking in or by getting in samples. It's a little bit more complicated than just doing it with the men. Yes, ma'am.
So, many times, like in my OPD, when I saw today, the couple just walks in about 4-5 days back, has never been investigated. And the first semen sample, after seeing all the blood tests, the semen sample report was the last semen analysis. And I see that there is absolutely zero count. So what I wanted to tell was that don't get alarmed just because one report says zero sperm count, but yes, we need to make a note of it. Then we have to see, the first thing to be told to the couple or the male partner is that did he have a faulty semen collection? Because many a times out of nervousness, it spills, he doesn't declare, he doesn't tell the lab that this has happened. He is a bit shy telling his partner as well. So it's very important that it is a well performed, and never discuss a zero count unless you have a second report coming in. So, 2 reports at an interval of about 2 to 3 weeks is good enough. And then we can, go about investigating the male partner if he has a zero sperm count. So it's very important.
Right. Thank you, ma'am. And then when you go forward to the wife, how would you go about? I mean, you said the blood tests, and then you've mentioned the ultrasounds. You've mentioned the patency of the tubes. You've mentioned the ovarian reserve. You've mentioned also the ovulation cycles.
So when
Suppose all of these are there.
So when my couples, they ask me, especially when they're coming, like I'm from Delhi, if they're coming from outside Delhi, I always ask them that time your cycle in such a way that you arrive the city or visit the clinic during the menstrual cycle of the female partner, because that is one of the best time to start or initiate the treatment. And if the patient really cannot come at that time, then maybe in the middle of the cycle for a woman, because I can then do a quick ultrasound and see whether she's forming an egg. But of course, I won't be able to check for tubes. But if she comes in the beginning of the cycle, maybe I can do the baseline hormonal testing, I can do the blood testing, I can order for a tubal test. And I also was to know that tubal test is a one-time test. It is not a test which would be ordered every now and then. No, if your tubes are open, they're open. Even if you switch from one center to another center, that doesn't mean that you are going to get the tubal test done, because it can be a bit of an uncomfortable process. So this is how I would do. And then if I have already made a plan for the couple, suppose I want to give certain drugs to enhance her ovulation, then the best time to visit is during the menstrual cycle, because that is the time where we can really start. So it's like climbing a ladder. It's climbing a ladder, and we need to decide that at what step this couple is. And this process is slow. If you think that you want to go from step 1 to step 10 directly, it's not possible, because at every step there would be a 20 to 30% pregnancy rate, and which will keep happening to every couple as and when they enter the treatment cycle. So it's a slow process. Patience has to be maintained. This is my sincere request, that stick to a center. Stick to a place for a couple of months, because results of infertility cannot come in, a month. They cannot.
Let me underline that and let me repeat that again. One is trust, or build trust with one doctor or center. Stick to the advice that's coming there. Do not start shopping around just because you don't see any results or nothing is happening in 2 months. It's not going to happen. Doctors are, especially for infertility, doctors are like detectives. They have to take one thing after the other and keep moving along till they have finally identified what is the difficulty. This will take time. Your best partner is your doctor, and make sure that you have her confidence, they have your confidence, and you can build together on the partnership. Because if there is a tubal patency issue, then that's a different line of work. If the tubes are okay, and if it's an ovarian function issue or a hormonal issue, then you have a different set of actions. She cannot take the right decision without patience and without having eliminated one after the other. Ma'am, suppose there are
there is two words which I just wanted to put forth, that when we were talking of pelvic infections, very commonly we see non-infective pathologies like endometriosis, which is very often missed, and which leads to a lot of havoc inside, and also makes the quality of life for the woman very bad. I mean, it's very low. So I think diagnosing it and not confusing it with pelvic infection is very important. This is one word which I wanted to put in. And also that about 30% of couples actually fall in this unexplained group. It's a very frustrating term where the couple comes to me and says the tubes are open, I am ovulating every month, my ovarian reserve is fine, and the semen is okay, and still the couple is not able to achieve pregnancy. Yes, this entity is there. It's a very common entity. It's about 30%. And here, this is the question which is very frequently asked to me, that what could be the reason? The reasons are beyond the anatomy. The reasons are more functional. The reasons are more quality. The reasons are more performance. And that is why a lot of unexplained infertility eventually also land up in IVF. So these were two special words I wanted to put in.
And so therefore, again, bears repeating, of the people that will land up, if 100 couples searching for infertility solutions land up, about 30% will be ma'am's black box.
Yeah.
Not quite sure as to what to do, kind of a thing. And it is trying everything going forward. The others, and this is where a quick question to you, ma'am, like we started off with infections, is there an earlier probability of picking up endometriosis earlier in life? for girls and for younger women?
Yes. So, on an average, it is said that it takes about 7 years for actually come to a diagnosis, especially for when an unmarried girl starts presenting. But I think chronic pelvic pain, extreme pain during, menstrual cycles in a young girl, we must start thinking of endometriosis in the back of our mind. And a good ultrasound can pick up many features of endometriosis, though not all. But of course, it is laparoscopy, which is the gold standard when it comes to picking up. So if there is chronic pelvic pain, extreme dysmenorrhea, then we should not be hesitant in putting a laparoscope and diagnosing. But it is not just diagnosis, it is also treatment. So every time you do an intervention, it should be with the intent to treat and not with an intent just to diagnose.
So if you've not got infections and hopefully there is no endometriosis complicating you, and you have done all your tests and it's a go towards IVF treatments, from then on, what are probabilities of a couple actually holding a baby in their hand?
So, I'll just put it that no, IVF is not the only solution. So when this kind of a couple is going through, they've gone through ovarian stimulations, they've gone through, monitoring their cycles, they have possibly gone through smaller procedures like intrauterine insemination, unless there is a clear-cut indication for IVF, like tubes overtly blocked, or, a male factor, severe sperm factor, which, qualifies them to enter IVF directly, but most of these couples would have gone through this procedure. So when they land up in IVF, I would say the probability that there would be a success in one go is about 50%. And so it could be 50 to 60%, which would be positive beta HCG. But also couples need to know that whether it's an IVF pregnancy or non-IVF, there would be a certain incidence of miscarriage. So eventually, per started cycle, about 30% of couples will have a baby in hand.
And what Dr. Shweta Mittal Gupta is pointing out to is the rather difficult journey that many infertile couples actually set out on when they are looking at IVF as a possible way forward. One, she's mentioned about 30% of the couples that will turn up with infertility, it's going to be difficult. And as a doctor, as the entire community, it's hard to explain why one in three couples will not have a baby. For the rest, it's not just the probability in the first cycle. There'll be repeated attempts at a start of a good pregnancy. Even if you have a start of a pregnancy, chances of miscarriages are also on the higher side. So all in all, it becomes a fairly difficult journey for the couple and also for the clinicians, because at the end of the day, they are also your partners. They're also kind of working along with you. So they also are holding you very, very closely and become very close friends. So just be mindful that this is not an easy journey and that you need a lot of psychosocial support. Again, to go back to an earlier thing that I had mentioned, it should not be a blame conversation. At the end of the day, whether there is a baby or not, the husband and the wife will be living together. It is your life. If a baby comes along, brilliant. It makes your life so much more better. If Dr. Shweta Gupta can help you achieve your desire of parenting a baby by yourself, if that's possible, all the more better. But this should not result in rancor between the couple, in the family, or elsewhere. Ma'am.
So I would say that at the end of 2 IVFs, that means 2 embryo transfers, I'm expecting about 60 to 70% couples to, at least have a positive pregnancy test. And it's good because these are the couples who are, on their own, having maybe a 10% chance of a natural conception at any given point of time. And then also I wanted my viewers to know that IVF is not the end of the fertility or road to fertility, because there are many couples who go through IVF for unexplained reasons, have their first child through IVF, and then make it, someday on their own. So that's not the end of your road. We can always go back to some other treatments if IVFs are not working. So I would say, yes, there are irreparable causes who would always need an IVF. And then there are certain causes which sometimes people can always go back and get pregnant too. So it's not the end, of the road, because couples are very hesitant. They feel that if they don't make it in IVF, then what next? So
thank you so much for that reassurance that couples may make it through a IVF and could go back to natural fertility too. There are cases like that happen fairly frequently. And then there are those that may not necessarily get through an IVF process with a baby at the end. That is not the end of the journey either. And there's always the possibility, and I have to kind of say this as a public service from IHW's side, is that there is always the possibility of adopting a child. And that
I'm
is not to be
completely
ruled
open.
out.
Yeah, and I very much promote. So I can tell you that, very recently a couple comes religiously, certain aspects of, fertility are not acceptable. She's aborting all the time. And I tell her that adoption is the best option for you. And why not? So
And
after
why
all,
not?
you'll go happy.
And why not? So what we have not covered is just this one bit, is that this is also a fairly expensive journey. The tests, the treatments, the cycles, they are very intensive, both from the professional time and expertise and resources. And so there are expenses that need to be met. And that is something that couples need to be mindful of when they embark on it, because it's not just possible just in the first time. It could be a couple of cycles, and there's time, there's costs, and there's expectations. All of these need to be held in balance. Ma'am, last words from you.
Yeah, so I think that, well, when I sit in my chair and I see happy couples and I see some unhappy couples, but that happiness which comes every day, I think is good enough to, keep the clock ticking. And I think, yeah, it is expensive, the treatment, but if you compare it to the Western world, then still it's much more affordable. But yeah, I think a very strong family support, at least in Indian setup, is something which can really help the couples if they have it. At least a bonding between husband and wife and a personal understanding. And we as doctors, yes, our role is very important to understand that how minimally we can, investigate or, do things for the couple, so that I mean, it's very clear, like every time patient changes a center, then you don't go about doing the test again and again, but we need to give more active management. So I think in my setup, I believe in very actively managing infertility. And this is what I want to say. After all, we need to be positive. And I always tell my couple that now, since you have entered a treatment, so maintain that positivity. We can do scientific, treatments, but what goes on backstage and at the emotional level, I completely understand is what couple is going through. So I think empathy is what we all can impart, and the scientific treatment.
Trust is the bedrock of a marriage and of a loving relationship. Openness and frankness between the couple and with the treating physician is necessary so that you can move forward with easier and then progressively more difficult interventions and solutions. Above all, it is a matter of support that the couple needs to provide to each other, the support that the family needs to provide to such couples, and we as a society needs to be a lot more supportive and tolerant about issues of fertility. It is at one level a matter of individual choices. And so therefore, if a couple decides not to have a baby, it should not be that people point fingers about that decision. That is also something that's prevalent in our society. If a couple has been struggling to have a baby and does not have one, that is not either the end or it's neither a blame game. And adoption is always something that is an option. Above all, you have the support of professionals like Dr. Shweta Mittal Gupta and the entire community of gynecologists and of IVF specialists across the country who can help you, support you through your journey to get to a desired parenting ambition. Thank you, Dr. Shweta, for your time
Thank you
with
so
us.
much. Yeah.
Thank you for this conversation. And thank you all for those of you who tuned in to listen to us for this past half hour discussing on this important topic of how to address infertility within couples. Thank you so much. Thank you, Dr. Gupta, once again.
Thank you very much.